Well, lots of confusion still over just which physicians are accepting patients under the Affordable Care Act. Last week, after our reporting, Covered California shut down the doctor search part of its website. On our Consumer Watch tonight, Julie Watts is still trying to untangle the mess that has some patients and doctors confused. They've made another change.
Yeah, and it's really frustrating for both patients and for doctors. Now, many patients chose their insurers based on that physicians list on the Covered California website. So imagine their surprise when they found many of those doctors wouldn't accept them as patients. But it was just as surprising for some doctors to find they were on the list. Tonight, why they don't want to be.
In addition to patients, paperwork, and paying the bills, doctors like Marie President are now spending a lot of time trying to clear up the confusion over Covered California's provider directory.
We found that we were already signed up, and we were astonished because we hadn't signed anything yet.
She's one of the many doctors who've discovered they're listed as in-network on the state's health exchange, even though they're not actually accepting patients with those Covered California policies.
We can't. We'll be out of business.
And that's the sentiment of many doctors opting out of the plans under Covered California.
There's a concern about how these are structured, whether the reimbursement will be sufficient.
It's an issue the California Medical Association has long been worried about. While the Affordable Care Act mandates what insurers charge patients, it doesn't regulate what they reimburse doctors. And it turns out some aren't getting much. Take a standard office visit. While rates vary by office, if a doctor bills $134, a standard insurance policy would reimburse them $87. But they'd only get $59 from that same insurer under one of the new Covered California policies. Even Medicare pays more at $84.
We can't maintain operations at that level of reimbursement.
She says the insurers do pay more to doctors who are part of large medical groups that negotiate with insurers on their behalf, but many feel the mom and pops and specialists are being price gouged.
Let's have you have a deep breath, please.
The result, at least for now, fewer doctors accepting the new policies and fewer options for the hundreds of thousands of patients who are signing up for them based on